Today's clinician, Kennedy, is responsible for completing the medical history review, taking vital signs of vagina, initiating emergency protocol, and ultimately deciding to discontinue treatment for patient safety. Zoe, the dental assistant, assists in retrieving the emergency kit, preparing oxygen, monitoring vitals, and supporting both the hygienist and patient throughout the emergency. Wade is a scheduled hygiene patient with a documented history of vagina. During treatment, Wade begins to experience chest discomfort, triggering the office's medical emergency response. Hila, the office manager, manages communication during the medical emergency. Hila stands ready to call EMS if symptoms worsen and ensures the reception area stays calm and organized while the clinical team assists the patient.
Good morning, Wade. How are you doing today?
Good morning. I'm doing pretty good today.
Good, good. My name is Kennedy. I'm going to be your hygienist today.
Okay.
Let's just kind of briefly go over your medical history. I saw that you listed stable angina. Is that still correct?
Yes, that is very much accurate.
Okay, and what kind of things would you say trigger the onset of this angina?
Well, for instance, a couple of weeks ago, I was at my son's baseball game. It was pretty intense as far as the score.
Right? Yeah. And I forget if Chris was here for a game. Somebody got one like right here. I was thinking it's
I felt a little pain coming on in my chest today. The drive in town was pretty bad.
Man, come on, drive. Everybody drives so slow out here, man. I gotta get places. I gotta go. I gotta go, man. Man, this dude just cut me off. Man, this dude just cut me off. Oh, can we pick up the speed?
Used to work with her. I knew her car looked familiar. She owed me about $5 from all the snacks at the vending machine.
Traffic?
Yep, so,
Yes, I know how Houston traffic can be.
yes.
So do you tend to get dental anxiety? Are you super anxious when you come into the dentist?
I am super anxious.
Okay,
Yes.
okay. We'll keep an eye on that today, and you let
Okay.
me know if you start to feel anything that could be suspicious of an angina attack, okay?
Okay.
So,
Okay, so before we get started with the procedure, I'm gonna take your blood pressure, okay?
Okay.
In patients with a history of angina, gathering baseline vitals is critical. Stable readings help us recognize when an emergency begins.
The blood pressure is 117 over 75.
perfect. No, 117 over 75 is nice and healthy. So we can go ahead and proceed with treatment as planned today, okay? I'm gonna go ahead and lean you back here, okay? We'll get started.
When recognizing angina symptoms, we look for classic warning signs such as tight chest pressure, pain that radiates to the left arm, jaw, or back, and shortness of breath. These symptoms are typically more intense, persistent, and physiologic than those seen with mild anxiety, which often presents as fleeting discomfort, hyperventilation, or a sense of dread without true exertional pain. Because angina can signal an evolving cardiac event, any appearance of these hallmark symptoms requires immediate cessation of activity or treatment and rapid clinical assessment. When a patient begins reporting chest pain, especially with radiation to the left arm, we must assume an angina episode is emerging until proven otherwise.
Everything okay?
No, I feel pain in my chest.
Okay.
Stop treatment immediately at the first sign of chest pain.
Let me
Hold on, baby. Hold on.
When it happens, of course, these are
Don't worry,
small,
stay calm. Stay
Oh,
calm.
Lord.
You're looking a little bit pale. I'm gonna go get the oxygen.
Okay.
We have a code red.
Do these symptoms feel like something similar to your angina attack that you've had in previous?
Yes, this feels very familiar.
Okay.
It's moving to my left arm. Oh.
Okay, we're gonna go ahead and get his blood pressure. Let's go ahead and check his vitals. And then don't worry, Wade, stay calm. Our emergency team has been alerted.
We have a code red. Blood pressure is 140 over 90.
So since Wade's blood pressure is elevated, we are going to go ahead and administer 1 nitroglycerin tablet, wait 5 minutes, and then check his vitals again. Okay, Wade, I'm gonna go ahead and administer 1 nitroglycerin tablet. This is what you usually take at home. I don't want you to swallow it though, okay? So I want you to place it under your tongue so it'll get into your system fast.
Nitroglycerin is used to relieve angina by dilating the coronary arteries and improving blood flow to the heart. It is indicated when a patient reports chest pain suggestive of angina that is not relieved by rest or other measures. Before administration, always assess vital signs, particularly blood pressure, because nitroglycerin can cause a significant drop in blood pressure. Ensure the patient is seated or lying down to reduce the risk of dizziness or fainting. The medication is typically given sublingually under the tongue, allowing rapid absorption. After administration, monitor the patient closely for chest pain relief, changes in blood pressure, and heart rate. If pain persists after the recommended time interval, a repeated dose may be considered according to established protocol.
And then we'll check your blood pressure again in 5 minutes. Time administered 2:55.
A few moments later.
So now that it's been 5 minutes after the administration of the nitroglycerin tablet, we're going to recheck Wade's vitals and see if his blood pressure has gone down.
After administering nitroglycerin, it's essential to continue closely monitoring vital signs. Nitroglycerin can lower blood pressure and relieve chest pain, but it can also cause dizziness or a rapid heart rate. Reassessing vitals frequently, typically every 5 minutes, helps ensure the patient is responding safely and allows the care team to detect any signs of worsening angina or hypotension. Observing trends in blood pressure, pulse, and symptom relief provides critical information for the next steps in treatment and keeps the patient stable throughout the episode.
Okay. Blood pressure is 115 over 70.
After treatment, signs of improvement may appear gradually. You may notice a slight decrease in blood pressure, reflecting reduced cardiac workload. Chest pressure often begins to ease, and the patient may report a sense of relief or less discomfort.
Okay, Wade, now that we've gotten your blood pressure to a stable level, I'm going to go ahead and end treatment for today, and I would really like you to go get checked out with your primary care physician just to make sure that everything is okay. Maybe if they need to run some tests, they will. But I feel better about that. How are you feeling now?
I'm feeling a lot better.
Okay, we'll give you a couple minutes just to get comfortable. I don't want you to get up too fast, just to make sure that you're feeling okay before I dismiss you, okay?
Can I get some water, man?
Yes, no worries.
Even after angina symptoms have resolved, it is essential to suspend any further treatment or dental procedures for the remainder of the day. The heart may still be vulnerable, and resuming activity too soon could trigger another episode. Thorough documentation is critical. Record the patient's vitals, description and severity of symptoms, interventions administered, and the timeline of events. Accurate records support continuity of care and provide essential information for future medical evaluation. Finally, it's important that the patient follows up with their primary care physician or cardiologist.